I'm Jennifer Kirschenbaum. I will be your host this afternoon, taking you through our educational materials for your benefit. And today we're going to be talking about HIPAA, but in a different way than those of you who have joined us before have experienced it. We're going to talk very practically speaking on approaches to areas of exposure in our practices on the day-to-day and what we can do to mitigate our potential risk and exposure. So before we get started into the meat of today's presentation, I wanted to go over who is overseeing HIPAA compliance on the day-to-day, so that way you understand where potential exposure would be coming from. And that area of our federal government is the Office for Civil Rights, which is a department of HHS. And the Office of Civil Rights historically has been a very amenable organization to be dealing with and has settled claims fairly innocuously. But their mandate has changed as of the new HIPAA law that came out last year. And they now are fining, and you may have seen, not just on our newsletter, but in the press, some substantial fines that are being levied from some major organizations from HIPAA exposure. And the Office for Civil Rights is required, mandated, to investigate any report that it receives or complaint from whoever it may come from related to HIPAA, or they're allowed to do their own inquiries. And there's going to be a number of different ways they're going to find out about possible noncompliance from HIPAA, not just from complaints from angry patients or possibly disgruntled staff or potentially competitors. It also is required that we self-report, which we'll get to later on, and you'll see that from the self-reporting, you may also be opening up a Pandora's box. So we're going to talk about ways to mitigate that type of exposure. You'll see here on the slide, which you've been looking at now for about a minute or two, that providers and insurers are included in oversight. Doctors and nurses, and by doctors I mean MDs, DOs, dentists, podiatrists, chiropractors, are all included in that definition of doctor here. So I know we have a mixed group on the call. It applies to all of you. What I'm also talking about today is going to apply to our business associates as well, in that they are required to adhere to similar mandates of compliance as are covered entities, because they are in the line of receiving protected health information. So this call is not specifically geared towards business associates. I will do another webinar probably in the next 2 or 3 weeks specifically for business associates and what they should be looking out for with regards to HIPAA. But this is mainly for covered entities, which I know is predominantly who we have on the line. So before we get into the steps that we should be taking, a lot of questions I get from clients is, do I really have to be worried about this, Jennifer? Doesn't this really affect, much bigger players, the hospital systems, things like that? The answer is yes. No matter if you are a one-woman practitioner and you have 2 medical assistants in the front and that's it, that's your whole shop, or if you are a massive hospital system, I know we have some on the line listening, this applies from the smallest to the largest provider. What you have in common, of course, there's plenty in common, but the main element in common is that you have protected health information in your possession that you're required to maintain properly in accordance with the laws. So anyone who is responsible for maintaining protected health information in accordance with the HIPAA security laws is going to be potential for a target from the Office for Civil Rights. So I'm going to give you some examples of what I consider to be extreme exposure, and this is where there were a lot of large fines. And you'll see how this could possibly extend to the smallest versus the largest structure. Now, when these fines are imposed, one of the main considerations on how much money is assessed is the size of the organization and their ability to pay, and what they would consider to be really a slap on the wrist. That way they change their ways. The first one I posted about this morning, and it is based on New York Presbyterian and Columbia. They were both involved in a server being errantly configured and access of over 6,800 patients' electronic protected health information being accessible on Google. So this was actually completely egregious. And when you search for a patient name, just for whatever search, you have an aggrieved girlfriend or boyfriend that is looking for someone, and they put this person's name into a search engine, their health records were coming up. And this was dating back to 2010, this level of exposure, and the fine was just assessed. So we're at $4.8 million. Sorry about this. This keeps popping up. $4.8 million paid over to OCR, the bulk of it being paid by New York Presbyterian, Columbia paying $1.5 million. Now, the question that I have is, if the fine had been assessed and this settled prior to the new law going into place and the mandate for OCR changing, which would have been, this happening more than a year ago, a year and a half ago actually, would the fine be as high? Because we are moving more into putative action by the Office for Civil Rights, and I think that maybe the fine might have been a little bit lower because the agency was a little bit more amenable, but who knows? They settled now, and this is a number that they're paying. This probably reaches to us a little bit more. In this situation, the size of the system, New York Presbyterian and Columbia, they both have internal IT support. They're handling a lot of things in-house, which is why, of course, they're responsible. For many of our smaller practices on the line that are outsourcing all of their IT work, the main thing is going to be, do you have a proper arrangement between your practice and your IT provider? And is it clear that your IT provider is taking responsibility for your servers? And if there's some sort of access or unauthorized ability to access on the side of where you are expecting your vendor to protect you, are they contractually taking on that responsibility? And so for those of us on the call that are taking some notes, that's probably the first thing that you should definitely be writing down. Can we go through our vendor agreements and make sure that they are contractually taking responsibility, that if there is any potential exposure on their end, they will agree to indemnify me? And I'm going to use that word probably a lot today. And that basically means that if it's their fault, will they take responsibility for paying for the damages, fines, or expenses or costs that are incurred based on the activity that has caused the problem? So you want to make sure that you check your vendor agreements and that the onus is on your IT provider for this type of exposure. Now, this is something that we're going to come back to later on when we talk about policies and procedures. This Hospice of Northern Idaho, and this is a repeat for some of you, I'm sorry. The HIPAA stuff is, we only have so much material to use. They had to pay HHS $50,000 for failure to conduct an accurate and thorough analysis of their risks. And what happened here, they had a laptop stolen. And we're going to get into a little later how we protect against this and what our main area of exposure is, which for the most of us is going to be our employees. But all of us, probably almost all of us, or actually all of us on the line, have laptops in our practices. Whether or not we're using an electronic health record yet, there may be emails from patients that are on that laptop. You may use it for scheduling purposes. And if it gets stolen, that information is, of course, protected health information. Any information that is individually identifiable to a patient, including a patient's name or social security number or driver's license number, their picture, anything that can be traced back to them is protected health information and is required to be secured. So even if you don't have an electronic health record, if you're using laptops or any of that type of information, you will have exposure. I like this Affinity Health Plan example because it highlights how if you take the in-the-box view of what your protected health information is and where it is at your facility, that you're probably limiting yourself. Affinity Health Plan returned copiers, which many of us have our copiers on leases, without erasing stored data. And up to 344,000 individuals' information was on the copiers. And Affinity had to pay HHS $1.2 million. Now, Affinity is a large health plan. It's not a small practice. If somehow it came to light that you had returned a copier and you are a practitioner in a smaller size practice, is it going to cost you $1.2 million? Probably, I would argue no. That is the fine that was assessed against a very large health plan, so I'm not trying to scare anybody, but I'm using this as an example for where do you have your protected health information. Think outside the box. Where could it be? Where is it hiding in my practice, and what do I have to protect against? So that's the point of it. Now, this is a dermatology practice, had a stolen thumb drive. Now, this is a very large dermatology practice based in Massachusetts. They have multiple offices. They're very profitable, and they were fined $150,000. Now, it wasn't that the thumb drive was stolen. It was that there was a failure to conduct an accurate and thorough analysis of the potential risks and vulnerabilities to the confidentiality of electronic protected health information as part of its security management process, and failing to comply with requirements of the breach notification rule. We're going to go over both of these elements today. What should be in your risk assessment and what our breach notification requirements are. So when you leave this call today, you will have an understanding on what your responsibilities are for both of those measures, which are both required. I liked what OCR said. They said, as we say in healthcare, an ounce of prevention is worth a pound of cure. I 100% agree with that. I think also what clients don't recognize, many of our clients do that work with us on a regular basis, I know many of you are on the call, is that it's going to cost a lot less for us to handle this now than to have to defend it later. So you want to take this as a summer project. That's why I'm doing it this time of year. This is a great thing to take on now. It's a lighter project, and try to get us in line hopefully by the fall. Okay, so is there a pattern emerging from the examples that we've reviewed briefly? I hope that the pattern you're seeing is that a failure to mitigate and a failure to have proper policies in place and a failure to do a proper risk assessment in your own practice is what the government is really fining for and penalizing people for. It's not the actual result, it's the cause. So we're going to go through how to prevent that now. So HIPAA exposure, where do you have it? You have it anywhere where there is access, maintenance, use, or disclosure of protected health information. So if we were to think about that now, it starts upon patient contact, when that physician-patient relationship is established and the appointment is made and a grievance is stated and there's notes in a chart, whether it's paper or electronic. The patients are coming in, we're using their names in the waiting room, their information is being taken back, we're sending it over to the referral source or sending it out to a specialist. All of this is use of protected health information. We then have information being transmitted to billing companies and being transmitted to carriers for payment. So there's a lot of necessary use and disclosure of protected health information, all of which is authorized, assuming that you have your proper policies signed by your patients and a proper privacy policy in place. And this isn't a lecture on privacy policy, so I'm not going to spend much more time on it. But assuming you have all of those things in place, then, of course, these are authorized uses of protected health information. Anything related to treatment, payment, or operational means are authorized by the HIPAA laws. So anything outside of that realm, we would have to look at to see whether or not there is a breach. And we'll talk about that definition or exclusions from that definition a little later today. Review requirements. You are required, pursuant to the HIPAA laws, to regularly review the administrative, physical, and technical safeguards you have in place to protect the security of electronic protected health information. Now, why does this say electronic protected health information, Jennifer? You just told me that everything has to be protected. Well, it does all have to be protected, but this particular review requirement is in the security rule of the HIPAA laws. And the security rule applies to electronic protected health information. Part of the security rule requires you to have on file a security policy, which specifies administrative, physical, and technical safeguards that you take at your practice to protect electronic protected health information. This webinar originated from a client asking me, Jennifer, if I have your security policy, am I in compliance with the law? And the answer that I gave, for those of you on the listserv who saw it, is you are in compliance with the law requiring you to have on file your security policy. However, you have to train on that policy, and you have to review regularly whether or not the safeguards are being followed to fully be in compliance. So a question I received today from one of our clients who's on the call was, again, Jennifer, we have your policy. Now what? So that's what we're answering today, is the now what. So we're going to talk about risk assessment now, and that's what I want to spend a good portion of our time on this afternoon. And I'm going to try to keep you for less than an hour if I can. I know many of you are on lunch. So available tools, and we're going to spend our time going through the Security Risk Assessment Tool, which was developed by the Office of the National Coordinator for Health Information Technology, also in conjunction with the Office for Civil Rights and the Office of the General Counsel. Why am I spending my time looking at this? Well, if the agency that is enforcing the HIPAA laws and is potentially the one that may be looking at your practice if you hypothetically have a problem, don't we want to know what they think is important to review? So that is the standard, and that's why we're going to spend our time going through the Security Risk Assessment Tool today. Now, you are not required to use this tool. It is not a requirement. It is meant to assist you in performing your required risk assessment. And I can tell you, having spent a lot of time reviewing the security tool in preparation for today, I can tell you that, some of it is duplicative, but the concepts in there are very helpful, and certainly I recommend everyone taking a look. So this is the website for the Security Risk Assessment Tool, and you'll have plenty more references to it as we go through some of the elements of the tools available. I do want to say that there's a lot of confusion because many of us work in hospitals and also in private practices about privilege and what information is privileged. If you are in your private practice setting, there is no privilege extended towards quality assurance measures or risk assessment that's done internally. The only way you're going to have any privilege extend to any audits and review for risk assessment is going to be if you work in conjunction with your attorney and your lawyer is assisting you, and the results are going to qualify as privileged under attorney-client privilege. So that is to answer the privilege question that we also received before starting today. So the Security Risk Assessment Tool has 3 different parts to it because there's 3 different areas that we're required to safeguard, and the 3 are administrative, technical, and physical safeguards. The Administrative Safeguard Tool, which we're going to go through some sample questions in a minute, it contains 73 different questions on administrative safeguards, and it talks about, or it inquires about, whether or not practices have an internal review process, a discipline policy, a gatekeeper policy, which is access in and out of the system, a business associate policy, and whether or not you keep an active list of business associates, and whether or not there's a procedure for authorizing users and changing authorization, screening processes for employees with access. So you do a background check for individuals who are coming in and working for you and have access to protected health information. It's probably a good idea. And whether or not you have a process for terminating authorized access, meaning if someone quits, you have a way to change their password, things like that. So what I want to show you, we're going to go through the administrative. Now this is the first example. So this is just piecemeal parts of the Security Risk Assessment Tool that I want us to go through this afternoon to just show you how it's going to work. This is the full form of how the questions are, and then the assessment process, and I only have one of these that's in full. So the first question that they have that I highlighted, and this is a 39th question on the form, the first one I wanted to hit on, is as part of your practice's ongoing security awareness activities, does your practice prepare and communicate periodic security reminders to communicate about new or important issues? Now, my version of this has this cut down, but I'm using exactly as they said. So do we have an ongoing security awareness activity that we have, and do we prepare, communicate periodic security reminders? So what does that even mean? And they have here a yes or a no. If they say no, why don't you do it? Because of the cost, the practice size, complexity, do you have another solution? I don't really think this part's so helpful on the tool, but this is the part I want to show you. This is very, very helpful, and I think it's good that OCR put this out in conjunction with the Office for IT. They have in each section, under each question, things to consider. So remember our question, do we have a security awareness program? Do we send updates? They give us things to consider to help us answer this risk assessment question. And the things to consider they highlight are that people are the weakest link in your security program, which is 100% true. And we'll go over some examples about employees really being the biggest problem that we face. They get busy, they forget, they try to cut corners to get things done faster. Periodic reminders can help to deter poor behaviors and reinforce good ones. So security reminders can be emails, they can be meetings, posters, and announcements. So the security risk assessment has flat out given us our answer on what is expected of us. And if there is a problem and an employee leaves their system on overnight and there's a snoopy cleaning person coming through and finds Britney Spears on your system and downloads that information or emails it or uploads it to Facebook, whose problem is that going to be? And how do we show that we are making sure that this doesn't happen to us? And the way that we do that is to show that we continuously provide support and training to our staff, and that there is an expectation. So that would be also through policy. The first area is that we would have policy. Our security policy that many of you already have flat out says that there should be protections, password protection, automatic locking, that the system wouldn't just be left on like that. So assuming you have a proper security policy and you follow it, this should be taking care of our scenario of the cleaning person hacking in and taking off your system. But in addition, you may want to task your security officer in your practice, who you've hopefully named and anointed, with sending out regular reminders and updating staff. Now, another area that they highlight in the risk assessment tool is possible threats and vulnerabilities. And they talk about your practice may not be able to safeguard if it does not have proper preparation and can't communicate periodic security reminders. That seems fair. Potential impacts they talk about include unauthorized or inappropriate access. That's obviously what we're trying to prevent against. Unauthorized disclosure, loss, or theft. We kind of just covered that, and we saw that in the examples for the fining, where there was a stolen thumb drive, stolen laptop. These are big problems. Then they give examples of safeguards. Now, we're still in the first question. I'm not going to go through this for all the questions. Don't worry. We're going to speed it up. But this is what you can expect to see under all of these questions for the administrative tool. So they want to make sure you have periodic security updates and disseminate security alerts and advisories directed to the workforce members. That's the first question we went through. Additional questions that they have under the administrative tool is, does your practice's awareness and training content include information about the importance of implementing software patches and updating antivirus software when requested? Now, for many of us, why am I highlighting this question? For many of us that have a smaller operation, we outsource our IT. So does your practice have training content about software patches? No. Why would it? Does it have policies on antivirus software? No. Why would it? But I can tell you what should have it, and you should demand from your IT provider, and we're happy to help you with this to make sure that you have it in writing, that if you are paying someone to be responsible for this for you, which you probably are, make sure that they are taking responsibility, because this is an area that we know the government is looking at. they want to make sure that you have this protection in place. So these contracts have to be reviewed, and we need to make sure that your IT provider is taking responsibility for keeping you up to speed and protecting you against malware, which is our next question. Does your practices awareness and training content include information about how malware can get into your system? Now, this we have to take a bit of responsibility for with the employees, again, who are going to be our biggest problem. Many of you on this call already know that. Your IT provider is the one who's responsible for the software patches, responsible for keeping your system up to date. However, what do we do about our employees opening malicious email attachments? They're cruising around and they want to read a story on TMZ or whatever. They click on a link and they've downloaded a virus that has now completely corrupted your system. What happens? Who's responsible? Well, do you have a policy in place that specifies that your employees are only authorized to perform their work functions, and do you limit their access to the internet while they're at work? These are things that you have control over that you can work on with your IT provider, and you can put protections in place, and you want to show that you have protections in place, so that way if, God forbid, there is a virus that is downloaded and it possibly corrupts your system and makes your protected health information accessible, you can show that you have done everything in your power to mitigate. And that is really what we need to protect you from potential fines, which is at the end of the day what many of us are concerned about, is having financial exposure for our inability or failure to properly protect the health information. Now, inability is what I'm trying to explain to you. You are all able to properly mitigate your exposure, and you do that through policy and through training, and you don't have to do that alone. Many of you already work with our office on this stuff, and we're happy to help you in any way that we can. So this was the administrative safeguards. The technical safeguards, which we're going to get to now, contains 45 questions on technical safeguards, including questions on, and there's a lot of duplicative information here, but access, security settings, emergency access. They make a big stink about emergency access, so we want to make sure we look at that. Backup procedures, automatic log-off, audit mechanisms for system activity, verification procedures, and encryption capabilities. Now, a lot of things on this list, again, fall under your IT provider. Plenty of them, though, do pertain to us, and we're going to go through a couple that I highlighted. So this is the first question on the technical safeguards. Does your practice have policies and procedures requiring safeguards to limit access to EPHI? And if you have a security policy in place, the answer to that is yes. You absolutely 100% do have policies and procedures requiring safeguards to limit access. Things that we should consider. We can protect against our potential exposure by adopting standards and controls, which we already know, and we want to make sure that we are establishing awareness and role-based training. What does role-based training mean? It means that you have employees for different functions, and their access and ability to reach protected health information, or what they should be accessing, is defined based on their role. If you have a medical assistant who is responsible for bringing charts back to you, but is not making any modifications to the records, is not involved in providing records to patients upon request, maybe this person does not need password access towards where you keep your EMR. Maybe this person is really just more of a physical role in the office, and we don't need everyone on the same system. Maybe we have the EMR locked and encrypted, and you have to key in to get to it, and only individuals who really need access to patient records are the ones who are authorized to access. So I hope this will get you thinking. Possible threats and vulnerabilities here. We want to protect against unauthorized and inappropriate access and use, unauthorized disclosure, and examples of safeguards that we have for this would be technical policies and procedures, which is what's included in your security policy. And we want to develop and disseminate an access control policy. So who has access to what, and what is your role, responsibility at the facility and we want to limit unauthorized access or unnecessary access. Remember, with the HIPAA law, you all probably heard this minimum necessary requirement or standard. We do not want to allow anyone more access than the minimum necessary for their job function, or the minimum necessary access for them to do what we need them to do. If it's a business associate and they're doing our billing for us and they don't ask for the entire medical record every time they submit a chart, then why are we sending it? We shouldn't be. Minimum necessary is what we should aspire to. This is the 8th question in our technical guideline. Does your practice define what constitutes an emergency and identify the various types of emergencies that are likely to occur? Well, regardless of the act of God that may come, what is the emergency that we might foresee? It could be loss of power. Loss of access to our electronic system. So we want to make sure that we have a written policy in place to address that potential. And if we're not keeping our server on our premises, then we may be entirely out of our control when that system is to come back up. And we may have already done everything that we can, back up the system, work with a company that has multiple servers, and there may be some areas that are completely out of your control, but this is what we're expected to do according to the government. They ask us to establish and implement procedures for obtaining necessary protected health information during an emergency. Sometimes that's accessible, sometimes it's not. Implement role-based access control policies and employ audited and automated override of access control mechanisms for emergency situations. So how do we get into the system? Is there a way to actually key in? Can we pull the data from somewhere? And again, your IT vendor may be the best person for this if you do not have all of this in-house, and you want to talk about, or at least find out from the vendor that you're using, what do you do with a power outage? Does that ever happen? Are you ever down? And if the answer is yes, then you want to find out what their emergency plan is and make sure that we have a copy of that on file for us. Okay. Does your practice have policies and procedures for creating an exact copy of electronic protected health information as a backup? You are required, the government is telling you right here, you are required, this is the HIPAA law, by the way, these are the references for the actual law, to have a backup of your electronic protected health information. Now, if you're not sure, you don't know if your vendor does this, or you don't know if someone at your practice actually knows how to do this, you should be inquiring. This is another area to take some notes. Establish an alternate storage site with necessary agreements to permit the storage and retrieval of an exact copy of your practice's EPHI. Make sure your system is set to automatically back up, if not at the end of each day, then at a minimum the end of the week. I would recommend every day, and make sure that you have access to that. Our 18th question here for technical, does a responsible person in your practice know the automatic log-off settings for its information system and electronic devices? Now, the thought process here is you may not be able to protect or secure or control access. And if you do not have an automatic log-off procedure that terminates an electronic session, then you may have potential exposure. So this came up before with the employee who left the computer on, and then we had the cleaning person access and download inappropriate information. How do we protect against this? Well, we have automatic log-off procedures and settings, and we put this on all the computers. Make sure that you have this in place. Follow up with whoever handles this in your office. Again, if it's the IT vendor, bring them in. Make sure you make a note. Let's put this in place. Does your practice have audit control mechanisms that can monitor, record, and or examine information system activity? So can you track what's going on at your practice? And the answer, even though some of you may think is no, is likely going to be yes if you talk to your IT vendor. You can be able to put in controls that will capture and generate audit records and will show you what type of information is being accessed by who. And it's just a question, of course, of time and being able to regularly review this and make sure that there's only authorized and appropriate access of your system. Does your practice have policies and procedures for guarding against unauthorized access of electronic protected health information when it's transmitted on an electronic network? So this is, are we sending our information safely? And this is a big issue. I know that sending files and encryption and which system to use is a huge problem for a lot of practices. Citrix has some good file share solutions. I know many practices use Dropbox. Some of these companies, for instance, Google, they're not repping that they are necessarily HIPAA compliant, but their encryption standards are at a level where we've called the government and inquired, and they've said, you know, we will not give you a definitive yes, but these security standards for these companies are certainly very, very high. So you just want to make sure that you're not using a non-reputable name that, you know, absolutely tells you we are 100% not HIPAA compliant. Do not use that for your encryption and for mailing. That will be a problem. Okay. Does your practice implement safeguards to assure that electronic protected health information is not accessed well en route to its intended recipient? This is the same thing. Again, you know, they ask the same question 8 times to make sure you really get the point. Are you encrypting properly? Are you using one of these systems? That's the easiest way that you can adopt a policy. Do not let employees send things from their Gmail account, okay? That is not an authorized email. The other thing I can tell you, a big area of exposure that I see is require confirmation of patient email addresses. It is so easy to type in the wrong name and have information go to a non-intended recipient. And if you're sending a record out, probably in response to a request, and you send it to the wrong individual, you will 100% be responsible for reporting that breach, not only to the patient, but also to the government. So you'll be creating your own exposure there, if you will. The last question I highlighted in the technical safeguards is, does your practice know what encryption capabilities are available? And we already kind of talked about this, but you want to make sure that you do a little bit of research, you or the appropriate staff member, and implement cryptographic mechanisms to prevent unauthorized disclosure and detect changes to information during transmission. So again, this is another one that I would highlight for our IT provider. So I think you're kind of getting the gist here. Let me just close this. That a lot of these security rule requirements are going to be discussions that we have to have with a vendor. And you may want to have them. You may want me to have them, you know, as your attorney, and that's fine. That is something that we regularly do get called in to do because, you know, a lot of our practices just don't have time to do that. But these are questions that you can certainly ask, and you want to get the answers for and make sure that we have them documented in a policy on file to show that if we do have to produce, that we have adhered to our requirement and we've done what we can. So the last grouping of questions, and I think the easiest for us to address and the ones that really we're responsible for, are the physical safeguards that we have implemented at our practice. And there's 38 questions for the security risk assessment tool for physical safeguards. And what they mainly talk about is the inventory of systems, devices, and media. Do we actually know what equipment we have and how it's used? Physical security, do we have locks? Do we have cameras? Again, we have disaster access, physical access during a disaster. Protection of keys, access log of users. We talked about that. You know, do we keep an actual list on who's authorized to do what? Unauthorized user prevention. This would be password protection, things of the like. Physical protections we kind of already got, but they ask about again. Locked doors, screen barriers. Do we keep guards on the premises, or is the building guarded if we're in kind of a communal space? A record of hardware and media removal. So we'll go through just a couple of questions here for the physical safeguards, and then we'll call it a day on the risk assessment tool, and we'll talk a little bit about policies. So do you have an inventory of physical systems, devices, and media in your office that are used to store or contain electronic protected health information? Now, if you don't have a list of what you're actually using, how are you going to know if there's something stolen? And that was the biggest argument and problem with that Massachusetts dermatology practice, is that there was a stolen thumb drive. They didn't authorize necessarily, I'm guessing, that employee to put information on a thumb drive. The employee walked out of the practice with it and lost it, and then the employer was the one who faced a $150,000 fine. And I'm sure a lot more money than that with legal defense and whatnot. So, you know, their exposure was much higher even than the $150,000, and then they had to go back and adopt corrective policies and whatnot. So, do we have a list of what we as the employer are authorizing our employees to use? Do we know how many laptops we have? Do we know what we've issued? And on the flip side, which you already know where I'm going, do we have policies in place that prohibit employees from bringing non-documented hardware onto the premises? Is it clear that they are not allowed to use their cell phones in the office and take pictures? I've actually had that question asked to me multiple times. Jennifer, I have a problem. My employee is taking pictures at the front desk, and the computers are on, and I know that there's protected health information. We've actually had this scenario before on more than one occasion where one of those pictures have ended up on Facebook. And so now we have a patient's information on an employee's Facebook account because it came up in a picture. So what do you do about that? Well, to protect against that scenario coming about, you have to push the onus on the employee. We have to have the proper policies and procedures in place, whether they're in conjunction with what's already in your employee handbook. We have a lot of these provisions in our employee handbook, which is standard, and then in conjunction with additional security type policies we put in place that are either customized or standard for what we use. You have to make sure that we are making it very, very clear that the employees are responsible for their conduct, especially if it's unauthorized. And we need to draw out very clearly what is authorized conduct by the employees. And that's what you need to have in writing. So this is a question that brings all of these issues up, and we want to establish for physical access control procedures. This is also what the government wants done. They want to make sure that you limit entrance to and exit the facility. So we need to have, let's say you code the door or you have physical keys. You want to know who has access to in and out at all times, especially if it's after hours when no one is there to kind of watch what's going on. Secure keys combinations. So this is all that they put into place. Do you have physical protections in place to manage physical security risks, such as locks on doors? Again, they're asking it again. Cameras in non-public areas to monitor all entrances and exits. Now, hopefully you do. For cameras, I just want to reiterate, I know I've answered this a number of times before, you are allowed to have cameras in any area that is that a patient would not have an expectation of privacy, or an individual, or an employee. So if you have an employee changing area, you can't have any cameras there. Bathroom, you can't have any cameras there. Exam room, where a patient may be changing, you cannot have cameras there. But everywhere else in the office is fair game. In New York State, we may have some other non-New Yorkers on the call, but in New York State, you are not allowed to record audio in a location where there may be two parties to a conversation that have not consented. We are a one-party consent state, meaning that the one party in every conversation must consent. And if you put a recording device in your office, you may pick up conversations from individuals where there is no one consenting in the conversation, so you are not allowed to record for audio. Do you have policies and procedures for the protection of keys, combinations, and similar physical access controls? Again, this is the third one that we're looking at, the 8th question in the series, talking about keys and access control. It's getting duplicative, so I'm not going to continue going through, but this is what they talk about in safeguards. Prepare an inventory of keys, know who has them, combinations, access cards, doors, and locks, and make sure that you track it. Do you have a user list? Do we know who has access to the facility? This is very, very important. Make sure you list members of the workforce, business associates, and anyone else who has access to your facility. And you want to make sure that you keep this list up to date. So it's not just who do you have today, but make a notation in your policies and procedures that you're going to revisit this list and you're going to update it on, let's say, not less than a quarterly basis. If you have in your policies that you're updating this list on a quarterly basis, you better do it. So if you're not willing to commit, you're not feeling that compelled, then don't put it in your policy that you're going to do it on a quarterly basis. Do you periodically review and approve your facility user list? We just went over this, right? So I'm not going to go through it again, but make sure you remove people who no longer are requiring access. Does your practice keep an inventory and a location record of all its workstation devices? Again, same question we've already hit. They're very duplicative. I'm just showing you that they really are hammering home these concepts. So for those of you who want to look at these policies, the risk assessment tool after our conversation today, the website is right here. We've shown it to you multiple times today. But you'll see the same questions keep popping up. And the examples of safeguards are very similar. Develop guidelines, okay, on how the workstations are accessed and establish policies and procedures. You're going to pretty much see the same thing in every area of the risk assessment tool that you're going to be using. So if you put any of your practices workstations in public areas, the answer for many of you is yes, because your waiting room may be quasi-public accessible. Your patients can see the computers as they're walking through in and out. Now, do you have those special screen protectors where only the individual staring directly into the computer can see? That's something you may want to invest in, especially for the front desk. So those are just some tips. Does your practice use laptops and tablets? We've already kind of gone through this, but laptops and tablets especially, you want to make sure, because they are, the government acknowledges they are more susceptible to incidental or unauthorized use, that you have them protected. For many of my clients that have employees that are possibly working from home or taking laptops or templates home to possibly finish records or things like that, they don't allow, or they have a policy where they don't allow the employees to actually download onto that computer. They ask that the employees log in remotely into their cloud, or log me in or go to my PC. They'll use and ask them to log directly into a computer at the facility or directly into the server. And so that way there's nothing saved on the local computer that could possibly be used by another user. Or if it's lost, then there would be information on that computer that could be discoverable. So those are things you want to keep in mind. Do you remove or destroy electronic protected health information? If you do, you want to make sure that you're doing it properly. We don't want to have the problem that Affinity Health Plan did and throw out a laptop and realize that we did not delete all of the protected health information properly. So we have a couple more minutes left. Let's see. I think you guys get the hint on the risk assessment tool. So I'm going to go back to our slides here. So adopting proper policies, as you can see, there are standard policies that you can adopt. One of them, of course, is a security policy, which for those of you who are regular clients, many of you have our security policy, and that's a very simple 2-page form, and it incorporates all of the legally required administrative, technical, and physical safeguards. It talks about risk assessment and management. It designates an individual in the practice to take responsibility for this. It talks about technical and physical safeguards, talking about access control, assigning a unique name, workstation, user accounts, and it talks about safeguarding the facility from theft and tampering. It's definitely a great starting point for you with your risk assessment as well. So adopting policies and procedures, the first thing you need is your security policy. Additional policies and procedures, and these are examples that I pulled from the risk assessment tool, is, and many of these are actually covered in the security policy, but one that's not is the employees working from home. I think most of us can say that we have people that are logging in from home, whether it's going to be doctors or administrators that are involved in our facilities. They are working from home, and many of us do not have agreements in place or sign-offs that protect us from unauthorized use or access to the hardware that they're using from their home base. And I think that that's one that I would definitely recommend you have in place. It can work in conjunction with your employee handbook and employment policies, and have employees sign off when they take hardware, have them sign off that they're going to adhere to the policies for protecting your information, and then have them sign off on policies that if they don't, that they're going to take personal responsibility. That's very, very important, and that they will indemnify the practice. We put that in our forms that we put together for everyone. Physical access to information systems. We want to make sure that we have this. This is in the security policy also. Protecting facility equipment from unauthorized physical access, tampering, and theft. Again, this is going to be a policy, but it's also going to be working in conjunction with actual protections that are put in place, hopefully from your IT vendor. Access control policies, who's going to have access, workstations, and whatnot. If you want to get much more specific and really get detailed, of course, no one will tell you not to. The devil is in the details, especially if you're going to be answering to possibly someone on this, and there will be a lot of audit activity from the Officer of Civil Rights. So, the more specified you want to get, it won't harm you unless you're committing to standards that you are not going to be adhering to. Employer protection through policy. This is your biggest area of exposure is going to be your employees. So this is just my advice when I thought this through. What did I want to impart on you today is you want to designate individuals in your practice who are going to have access. You're going to delegate certain authority, and you're going to delegate specific authority, hopefully. And I would recommend that for all of our employees that we are employing specific job descriptions. And in those job descriptions, start thinking about what type of access does this person really need, and what am I going to give them? And then think about quarantining off parts of your practice that this individual really does not need access to. And once we start developing that infrastructure and those types of protocols, you really will be developing, your protection against this type of exposure. And that's what we're doing. We're trying to create good habits here. Shifting liability, I started with this, and I'm going to partially, we're pretty much almost at the end. I'm going to end with it. We want to shift liability by contract for things that we are not responsible for. We cannot take responsibility for all of our employees' actions. We are responsible for them if we do not shift it towards the employee and we do not have proper policies and procedures. We are not responsible for the acts of our business associates unless we have not properly contracted away the responsibility. If the business associate can point the finger at us and say, you gave us all this information and you emailed it to us, improperly, and you're the reason why it got disseminated inappropriately, this is your fault. Take responsibility for that through contract. Push the onus on the business associate. Make it clear that the information that you're sending to them, that they are telling you they're receiving, is done properly, and that their system is encrypted, and that they will take responsibility. You are required to have a business associate agreement with every single business associate you do business with. There is a Form 1 of it on the Office for Civil Rights website. So no matter what your financial state is, you can use that document. That document does not push the onus for payment on the business associate. If you want that type of business associate agreement, which you should have because you're contractually able to move your financial responsibility over to the business associate, you will have to work with your attorney. Many of you have our business associate agreement already. You know we do it for a flat fee that's very low, and I'll show you our policies in a minute. But I recommend that you have liability shifting, exposure shifting provisions in all of your documents, and only take responsibility for what you can control. The example here I put on, which I think we've already gone over, is the employee working from home with the employer's equipment. The employee signs off for the equipment and the agreement to take responsibility for proper use and access. The employees take responsibility for. We have written confirmation the equipment will be used by the employee exclusively and for work purposes only. What is the benefit here? The benefit is you have now properly shifted the responsibility for maintaining HIPAA protection to the employee. And we are going to have an indemnification provision in here that if there is exposure, the employee is going to be responsible for taking responsibility of that. And we would be able to show all of this to OCR if there were a complaint or if we had to self-report. Now, breach notification requirements. We're going to go through it quickly because that's not the purpose of this entire webinar. But notice to the individual, if you have a breach, which we'll go over, maybe I'll go over it now. A breach is any unauthorized use or disclosure of protected health information. If it's not for treatment, payment, or operation purposes, then you pretty much are not authorized to have had that interaction or disclosure of protected health information. So it's going to exclude certain elements too. It's going to exclude disclosure to staff or another practice or business associate that's properly contracted. And if such acquisition was made in good faith and within the scope of the authority. So staff to staff or staff to another practice that's authorized is not going to be a breach, even if it's not for treatment, payment, or operation purposes. So you fax the wrong patient's information to a provider that you typically refer patients to. That is not going to be a breach. Disclosure is made, but you have a good faith belief the recipient won't and can't retain the information. Very simple. You have a discharge form you hand to a patient. The patient walks out. It's not their discharge form. You catch them in the parking lot and you take it back. Is that a breach? Well, did they take a picture of it with their phone? Do they have a photographic memory? Is there anything on there that is going to possibly be retained? Is the patient name generic for who the patient actually was? Was there a diagnosis that's very sensitive on there for, sexually transmitted disease or something like that? If the answer to all these things are no, and it was just a simple discharge form, then the answer is you have a good faith belief the recipient won't and can't retain the information. So likely not a breach. So these are all things. Then you can do a risk assessment, which you should do anyway if you do have a potential breach. And if you could show there's a low probability that the protected health information has been compromised based on these factors, which you've hopefully already read, because I'm not going to take the time to read through them, then you can also show that you have not committed a breach. So we quickly went through, and we kind of know what a breach is. If you have a breach, you are required to notify the individual by mail or email, if it's only a few people or one person. If it's more than 10 people, you're required to post notice on your website. If it's more than 50 people, you're required to notify the media. You are also required to notify the government. If it's less than 500 people, you can notify the government on an annual basis. You have 60 days after the end of the year to notify the government. Every year you're supposed to be notifying the government of a breach. If it's more than 500 people, you are required to notify the government within 60 days. So what would be more than 500 people? Jennifer, that's crazy. Why would I release that much information? Well, if you lose a laptop that has downloaded on it, your ARs, let's say, even by patient name and amount and procedure code, because your billing company sent you a report that you downloaded locally on your computer, and then your kid takes that computer to school and loses it, guess what? You've now lost more than 500 people, potentially 500 people's protected health information, their name, their procedure code, how much they paid, what kind of, maybe there's information about the services in there. That would be required to be reported to the government and also technically to the media. So there's definitely a real onus here on the practitioner. And I know no one wants to hear about additional requirements and administrative work that they have to take, but this is serious. There is a lot of potential exposure here that can easily be mitigated by what we talked about today. The risk assessment tool, which you're required to do on a regular basis, not the tool, but the risk assessment part of it, and the proper policies and procedures you're required to do. So many of you are on our newsletter already. Many of you are already clients of our firm. So we're already working with you on a number of projects. If you want more information, a great resource is, of course, our website, which I have up here. This is a Security Risk Assessment Tool web page, and they have an interactive program that you can go to, or you can just look at the risk assessment tool here in Word version. Our website, many of you already know that our newsletters are located right here. Our policies and procedures are located here. And you'll see the security policy we sell for $125, a basic security policy. The breach notification protocol, this is for staff training purposes on what is a breach and how do you handle it. We sell for $75, so everything is very reasonably priced. Business associate agreement with the indemnification provision and proper protections is sold for $150. So the resources are our website, practice webinars. And it's tough to take questions because obviously no one can talk to me. You're all listening to me. But questions, if you do have them, you can feel free to email me anytime, and I'm happy to answer them for you. I did put together a couple of polls for today. Let me see if I can figure out how to launch them, just to see what the interest level is. So this one is, okay. I asked how many of you are worried about HIPAA exposure, and this will help me gauge for future webinars. Let me know, see if you guys can vote here. I'll give it another minute, then I had some other questions for you. I have a lot of yeses, some maybes, one not really. Mostly yeses. Okay. So I'm going to close this one out, and then we'll talk about, I think this is going to be the one that's, I want to do a risk assessment, but I'm worried about the cost. That's what this question is. I'm going to post this. Let me know if this is the main concern, because I have a feeling it is. The risk assessment you can do internally. You don't have to hire anyone else. If you want to keep everything privileged, as I talked about, you should be using your attorney in this process. And if you were to call me and say, Jennifer, I really, does that mean I have to pay you a lot of money if you're going to help me with this? And the answer is, if I'm coordinating it, no, it's not going to be a lot of money, and I'm happy to help you. If you want, to work with a consultant who's going to take over the entire project for you, which our firm is happy to do, then it would be a different story, but we can talk about that on a case-by-case basis. I think that the risk assessment can be done on a lot of different levels. You may have seen a lot of the questions we talked about today were duplicative, and there's some basic areas that you can kind of just create a checklist for. There's the checklist that I have in my head that probably has about 20 questions that you could go through, related to emergency preparedness and access, and which employees actually have access to what systems, and do you have a list of hardware that you actually use, and then have you taken your steps to mitigate exposure from your employees. And I think that, if you can hit off those main areas and also have a very open conversation with your IT vendor, I think that you're really doing a lot to take your practice from where you are now to protect it. And that's the IT conversation you may want to work with your lawyer for, because you're going to want that IT vendor contract reviewed, and you're going to want to make sure that they're taking on responsibility for what they have to do. So this is another question that I put in. HIPAA, true, false. HIPAA is a bigger threat to my practice than malpractice. I don't know how many of you are going to agree with me, but that's what I think. I think 100% that HIPAA is a much bigger threat to you than malpractice, because everyone who walks in the door is most likely a patient, right, if they don't work for you. And if they have a bad experience with you, and I'll give you a very simple example, and then I'll let everyone go for the rest of the day. But I had a couple of clients who had problems where patients were asked to pay for records, standard thing. And patients were mad, or they didn't like what you charge them, and they just don't like you. One of the easiest places they can make a complaint about you is to the Office for Civil Rights. And the Office for Civil Rights is required to investigate. And once they're in there, regardless of what the complaint is, they're going to start asking you about your privacy policies and, what kind of protections do you have in place for your electronic protected health information. They're going to call you with these questions from the Security Risk Assessment tool, which is why we went through it today. So, and then they have the ability to fine you if you're not in compliance. So I believe that HIPAA, there's a lot higher risk of you actually having exposure from HIPAA than if you are sued for malpractice. So I agree. I think that it's a bigger threat to you than malpractice. Now, that's what everyone's mainly concerned about. So I hope that you found today's webinar engaging and helpful. I hope it wasn't too boring. If you have any follow-up questions, please feel free to reach out to me at any time. And if you have other topics you'd like us to go over, or maybe more in depth on certain issues that I touched on today, let us know and we'll schedule it. And hopefully we'll see you all again soon. Have a great day. Bye-bye.